All right, so it is 9 o'clock. We're going to get started. Welcome to mass immunization trainings for personnel responsible for managing pods. This is our fourth training for this audience of fire departments and emergency managers. And we are really happy to welcome a lot of healthcare partners today too, because our federally qualified health centers are also getting ready to do pods. So many of them have joined us today. And just so you know, FQHCs, we've been talking about you on this training. We have definitely been talking about you on these trainings, and many of you partner with our fire departments and emergency managers teams. So you've been getting lots of love on this. So, and as a reminder, this is brought to you by TAPI, the Arizona Partnership for Immunizations. We are your state vaccine coalition and have over 400 members, a public-private partnership throughout the state. We're really happy to partner with you to improve outcomes. And our mission is to foster community wellness and advocate for good public policy and best immunization practices. Today is about that third part of our mission, because we're going to talk a lot about best immunization practices. So, and I'm Rebecca Nevedale. I've been a member of the coalition for many years. And Macrina, do you want to say hi too?
Hi, I'm Macrina Leach, and I'm with Maricopa County Department of Public Health. And I'm really excited to have this vaccine out and people getting it. It's like history making.
Yeah.
History making.
Yeah. And Macrina is our nurse expert. So she is the clinical expert today. And then Jennifer Tinney is also on the line. You've gotten to know her quite a bit on the chat. But Jen, do you want to just say hi and maybe tell them what you do at TAPI too?
Hi, I'm Jennifer Tinney. I'm with TAPI. I'm the program director, so really try to make sure that we have the tools and information that you all need as you're vaccinating all of your patients throughout the year, whether it's childhood, adults, or now this pandemic. And Rebecca, I have to thank you for the very young picture that you have included there that was many years ago, and I'm not even sure where you got it.
I think that is a pre Max picture, isn't it?
That was very pre-Max. That was actually at the Biodesign Institute before H1N1, when we were talking to them about developing pandemic vaccines and some of the work that they're doing with the tobacco-based vaccine platform. It was a fun day.
And for
many years ago,
who don't know who Max is, so we've all worked together in TAPI and in vaccines for so many years. Max is our H1N1 baby. He was born right at the height of that pandemic, but don't worry, Jennifer has not had any more. She's not having a COVID baby. Right, Jen?
No more pandemic babies. Thank you.
Okay, so we have met 4 times. This is our 4th meeting, and we've talked a lot about just how do you set up a pod? How do you run a pod? So how do you get your site? How do you think about staffing those clinics? We've gone through all of the whole vaccine delivery system, from the time you order that vaccine, store it, handle it, what do you do? How do you screen for contraindications once the patient is in front of you? A little recap on how to actually administer those doses. How do you draw it up? How do you poke it in the arm? How do you watch for something normal that happens after, or something crazy and weird if you are the 1 in a million person who gets to see one of those crazy things that happen. And then we've also talked about workflows for drive-throughs. Many of our fire departments and emergency managers, and also our FQHCs, have done drive-through flu clinics, drive-through COVID testing clinics. And we've tried really hard to create this space as somewhere where we can give tips and tools and do some presentations, but also that you can just kind of ask questions of each other about how you're approaching your pods. And, you know, we've been preparing for COVID vaccine and now it's here, which is very exciting. But the need to learn from each other as we're all building this ship while we're sailing is really, really critical. So we hope that you participate actively today. And through the chat box. And when it's time, unmute yourselves and ask some questions too. But we are going to talk mostly today about storage and handling. So we're going to go over storage and handling requirements of both the Pfizer and the Moderna vaccines. Both of those are ones that you could possibly get. You're more likely to get Moderna. So we'll spend a little bit more time on that. We are also going to talk about the state vaccine distribution plan because that's something that you've asked for information about. And a lot of that is actually county specific. So we will give you what we can, but if you need help connecting with the right person in your county, feel free to reach out to us and we'll try to get you in touch. And
can you hear Miriam?
And make sure everyone's muting yourselves before you muting yourselves if you're not talking. And because we've been doing COVID pods, we've seen some mistakes. So we're going to talk about that. One of our favorite things about you medics is that you like to talk about your failures as much as we like to learn from them. So we hope that you'll share yours too. So, and Macrina, other than our federal partners with the VA and on tribal lands, the first person to give Arizona vaccine was our very own Macrina Leach. So you may have seen her on your Facebook feed or on the news. And Macrina, before you gave that, did you know all the storage and handling? You had all that memorized, right?
So I read it like 3 or 4 times, and then I discovered on CDC website that they have a really good job action sheet that will tell you all about preparation. And so I took that with me and I followed the directions the first time because this was the first time we had ever mixed this vaccine or administered it. After you do it once, it's not as scary, but it is a little, plus it's much harder to do it under lights as well. So that's all I'm saying there.
Yeah.
But you know what? It's not as scary or worrisome as you think once you do it a couple of times.
When I think we're hearing a lot that people are scared because the stakes are so high, and especially the stakes for wasting vaccine are so high because, I'm not in phase 1A or 1B. I haven't had my shot yet. And there's a lot of us who are really eagerly waiting. Even those of you who are still in phase 1A or phase 1B are eagerly waiting. So we wanted to get kind of a gauge of where you all are at in your kind of COVID journey. So, and then we'll dig into the distribution plan. So there's a poll that popped up on your screen. What are your next steps related to COVID-19 vaccine? And we'll keep this open for a little bit. All right, I'll give you 5 more seconds. All right, that was 10, but they're still coming in. So I will share those results. So it looks like most people are ready to roll as soon as you give them doses, Macrina. You and your colleagues at the other counties. But many people are already vaccinating themselves. So for those of you who are already vaccinating yourselves, please share your successes and your failures right there in the chat because we want to learn from you. And same with those of you who are vaccinating in partnership with the county. So, okay, Jen, they want to know when they're getting their doses. So tell us about the distribution plan.
Oh, I wish I had a crystal ball that could tell us when we were all getting doses, but we're getting a little bit more, so it should be easier. But if you want to hop to the next one, I thought I would just give a little bit of an overview first of how a pandemic vaccine is allocated and how that works. So first, the CDC sends ADHS the number of doses expected for Arizona based on our population. And then ADHS has to divide that by county population and allocate it to the county health department, so that the county health departments know and are working with partners and where that vaccine should go and would be most effective. So then the counties allocate those doses to their partners, to the pods. They work with you all to figure out where it's needed in the community, where we know we have gaps, where we know we have really high risk patients. Then ADHS links those doses in ACES to that provider. So if you've worked with the county and you're going to do a pod with them, or you're going to vaccinate some of your patients, they're going to go ahead and link that in ACES. You go into ACES and accept the doses. And as they're shipped to you, then you verify that you've received them. Then once that happens, the CDC sends it out to the distributor gets it to you, you guys administer the doses, you report those doses to ACES, the vaccine inventory is adjusted within ACES, and then everybody gets to kind of do it all over again. They take a look at how many you've given, how many we know you need to give, how many are coming in. Right now, the CDC is allocating to the states about once a week. So every week, you could see that inventory amount change as the county starts to allocate those doses to you. So you all report that information to ACES, and ACES sends that information over to the CDC. They know that we've given that many doses in Arizona, and then they send us more based on our population. So that's kind of how that works and why there's so many data points right now and trying to exchange information. If you want to hop to the next one. So this is a little bit of where we are right now for the tier phases that we're looking at. So we are actually kind of rocking through these, not that we've finished them, but at least we're beginning to touch all of these different population groups. So phase 1A, of course, was healthcare providers. We want to protect them first. That includes the EMS system, long-term care facilities, all of the staff that works in the health system, because we need everyone in order to make sure that we're taking care of patients. So then we go to phase 1B, which we hit a couple of weeks ago. And those are, again, people that are high risk. One of the things that we prioritized was teachers and childcare workers, because I don't know about you all, but I'm ready for those kids to go back to school. And any minute, you all might meet Max, who shares an office with me now, as my cubicle mate. So we want to vaccinate teachers as quickly as we can so that we can get kids back to school and kind of get things, you know, into a normal flow for families. This also includes police, adults over age 75, and really our high-risk essential workers. But one thing that happened yesterday, I don't know if you all have been following it, excuse me, but on the national side and now the state, HHS has decided to release all the doses instead of holding back that second dose. And as a result of that, they want states to move down to age 65, and Arizona agreed to move down to age 65. So you're going to see that messaging begin to change. But this is a lot of people, and we're not through each one of these tiers yet, so it gets a little bit tricky. If you want to go to the next slide. So this is how patients can get information. Whether or not you have doses or not, I'm sure you still have a lot of people who are asking how they can get a vaccine. So on one side, we have the ADHS patient portal, and the link to that is where they can go to register. On the right side of the screen, we also have another link for ADHS that includes some of the partner sites. So has anyone done the patient portal that knows whether or not when you go into the patient portal, does it have all of the locations listed? If anybody knows that, you know, send it in the chat. But I can tell you that on the partner link that's over on the right side, this is where it'll pull up a map, show you all of the locations that have vaccines, and then you can go in and select one. And when you do, it gives you this little pop-up. I did this example of Canyonlands has vaccine available, the community health center. And then from there, you go and register through the Canyonlands site. And they have a website that tells you, you know, we're still waiting for our vaccine, we're getting ready, and we're focusing on high-risk groups. So in this case, you can go to each individual partner and find out where they are a little bit in their inventory management piece. So I know a lot of you are getting information about make sure that you sign up for Vaccine Finder, make sure that you sign up through the registration system, make sure that you hit all of these places. And it's because we're trying to integrate all of these systems. You know, we have a lot of systems in healthcare and they don't always talk to each other nicely yet. So everybody's kind of unrolling this as we go. And we're trying to make sure that we do connect those and we get them all together. This will get easier, but right now, everybody in the world is asking you who you're vaccinating and when you're vaccinating and what you're planning. And it can, you know, feel like it's a little bit redundant, but know that you're working with the county health departments because they decide which partners are going to hit the community targets best. We're working with ADHS, of course, CDC, and the national groups want all of that information too. If you want to go to the next slide.
Yeah, and we're getting a comment, Jen, in the chat box from Jeremiah that when you register, it shows sites within 50 miles of your zip code. So it will only show HS sites, or if you register for the county, it will only register county pods at this moment.
Okay, that is good to know. Thank you. That gives us a little bit more information, but you've got both links here that you can share with patients. Also, the helpline information line for patients who are looking for a vaccine. And then 211 is also set up to try to get information to people as well. You want to hit the next one?
Yep.
This is for the stadium clinic, you know, just an update on that because it came together very, very quickly. And last week was announced that they're going to be open 24 hours a day giving shots. They have 81,000 appointments so far booked through at least January 31st. I'm sure that's higher by, you know, after yesterday. More appointments are being slotted for the next priority groups and for the second doses. This stadium clinic is open to all Arizonans, no matter what county they live in, although it does take away from the Maricopa County allocation because it's located in Maricopa County. Whatever was allocated to Maricopa County is going to be cut down based on what's going to the stadium. So if you thought you were getting a certain number of doses and that might be a little bit lower, this is why we're trying to kind of spread them out as much as possible. Next slide.
And I'd say too, on this slide too, Jen, that if you, because people are in the chat saying, you know, they're booked out, and I know that they are continuing to add more slots. So whenever you're trying to help your spouse or your parent or someone book their doses, keep refreshing and keep checking because more slots continue to get added. And also as other pods and things start opening up, we expect that people will start canceling some of these appointments as well. So slots will start open. We know that's not perfect, but do it. And then also when you're looking for a site on that finder, it says Jean Feely saying that you can uncheck or Catherine Ballard saying you can uncheck the box for 50-mile radius. That's especially important, I think, for those not in Maricopa County who would be willing to come down to State Farm.
Oh yeah, absolutely. And play around with it. Last night I was kind of trying to go on just to get some screenshots of it, and it'd stop, it would refresh. It was a little difficult. So if you have some older patients or those that are not as tech savvy, maybe try to help walk them through it a little bit. Also, maybe send them to the helpline and see if someone can walk them through. 211 is also there to help them get to those appointments as well.
Yeah.
So as far as our vaccine supply goes, HHS and CDC will be releasing all of the vaccine that they have. So the original plan was the CDC was going to hold back in inventory the second dose so that those second doses could be sent to the locations that have already done a first dose. And then the new vaccines that were being manufactured and produced were going out for those first dose pieces. So they've changed that. Every vaccine that's being produced is going to go out. That means you guys have to kind of manage and balance a little bit who gets dose 1, who gets dose 2, what your weekly allocations are beginning to look like, and what you need to do to organize those for those 2 doses. Next slide. So here by the numbers so far in Arizona, we've reported that we've given 165,000 doses. And that's, based on all of these inventory systems trying to talk to each other. It might be a little bit behind that. But we've had 456,000 doses delivered to Arizona. We have a lot of sites who have booked appointments out for a couple of weeks. So if they have some vaccine in their refrigerator, it's because they're expecting patients to come in tomorrow, the next day, that they're holding on to those vaccines for. We have 180 phase 1 and phase 1A and phase 1B sites that have received supplies, including county health departments, now the FQHCs, pharmacies, and other key providers. Next slide. So CVS, Walgreens, and pharmacies, and the pharmacies have signed up through the CDC to get a separate allocation of vaccine to do long-term care sites. And then there's a second program through the CDC with a direct allocation to do some retail vaccines. So far, 2,000 long-term care sites are signed up for that, and they've been able to get out to 146 of those skilled nursing facilities. These are time intense. They take a long time to get through. They have to go 3 times to make sure they get first dose, second dose, and then any follow-up for anyone that they missed. So these are going to take the pharmacies quite a bit of time to get through. So if you're getting questions about, well, I have, my grandmother's in a long-term care and she hasn't gotten her vaccine yet, they are getting there. ADHS has also requested that the pharmacy retail program be open so that some people can go into the pharmacy. I think right now what we're trying to do is to see if we can get the patients over 75 into those retail pharmacy locations that will be listed on those registration sites as soon as that opens. You want to go to the next slide?
Yeah.
So this is the doses administered by county and the current priority group that they're on. It's going to take, each county might be in a little bit different place along the way, depending on their population, the partners that they're working with, and exactly how it's going to roll out. But this just gives you an idea of total doses administered. Next one. So this is the allocation and prioritization. So 609,000 doses have been ordered, but next week we're getting a little over 500,000 doses. So you can see that we're almost going to double what we've had come in a week's time, which is really going to open up a lot of that. But this is how they're allocated by the population size. That's why those numbers look the way they do. And then the next slide. This is where it gets really tricky. So I just use Santa Cruz as an example. They've been allocated 1,900 doses so far this week. That's what they've received in Santa Cruz County. But in their phase 1A and phase 1B, they have 1,000 healthcare workers, more than 2,000 Border Patrol and police, 3,200 that are over age 75, not to mention their EMS and their support staff. So they would need 6,200 doses just to hit tier 1 in the beginning of tier 1B. Now we've moved to tier 1C, as a country and as a state, down to age 65, but you can see they're way off from being able to get to those patients. So this is where the hard decisions are going to come in. Though we've moved to age 65 and up, it doesn't necessarily mean that those vaccines are available in those communities to make sure that we get everybody covered, but they're getting there. Once this starts doubling and we start getting shipments every week, it'll go much faster. But in the beginning, you're going to have a lot of frustrated people that you're talking with who are saying, I saw on the news last night that I get my dose because I'm 65 or 66, and they just might not be available yet. Next slide.
I think that's just,
So
Jen, I think that's something that people really need to, I think that's why we're trying so hard to work with these newer partners like the medics and EMS to distribute, because we're talking a lot of people that need to get these vaccines once we have the product. Right now, we don't have the product. So as crazy and chaotic as this feels, we are practicing for 1C when we have ample supply. And we need to be able to give, 5,000 a day at a pod if possible, because we're just talking so many people.
Yeah, and absolutely. And this whole thing is really learning as we go. It's a good way to say that those, these first clinics are, sorry, that's my dog. These first clinics are really practice for what's coming when we hit these huge population groups. But we're practicing everything. That's our reporting systems, that's, smoothing it all out, messaging, all of it. And now that we're beginning to phase in more sites, and there should be about 120 sites that are now coming on this week. We have 730 providers who have onboarded through ADHS and have been approved to receive vaccine. We have a whole lot that started the onboarding process, but maybe haven't finished it and all the training pieces that go with it. So check to make sure that you've gotten all the way through that process
Right.
through the ADHS system, so you can get vaccine as soon as it gets here. Next
Right.
slide.
And also there's a couple questions about those numbers. When we say doses, we mean a mix of Pfizer and Moderna. And then another question of, and honestly, most of the Pfizer, Macrina, most of the counties are kind of keeping that Pfizer, right? Just because it's a little more complicated to have to bring that many people together in one fell swoop.
Well, I think we're in Maricopa County, anyone who has the ability to have ultra cold freezers, something that goes anywhere between -60 to -80, we're sending Pfizer. I think we need to recognize that Pfizer is still going to be a vaccine for years to come. The storage and handling may become a little easier over time as the vaccine's on the market longer, but we really are identifying providers who can immunize with Pfizer.
Okay.
I think the county health departments can do it all.
But when we look at number of doses, we look at all the doses that are
correct. We look at all the doses, Moderna and Pfizer.
And soon, new vaccines will be hitting the market. So this problem of not having enough supply will hopefully get better in the near-ish future. So,
Right.
And then another question around the second dose: how do patients make sure they get the second dose, the same product for their second dose? And we are really urging you, as you're doing pods, to ask your patients to come back to the same pod. The same pod will have the same products right now. So we're really asking you to tell your patients, come back here for your second dose. If you are doing kind of stand-up one-day closed pods for county employees or law enforcement, give them that same message, and just plan on being able to track those people who don't show up for their second dose and tell them where to go, which pod to go to, so that they can make sure they get that same product for their second dose if they miss your clinic. And we should learn a lot from the long-term care who are going 3 times to see if that helps them catch everybody. So, but go ahead, Jen.
Okay, so, and I know that it's still getting confusing about when the next group is going to get vaccine. Right now, we're trying to focus on those large clinics to hit those target populations. And I am so sorry. This is what happens working from home with dogs and kids. But I think the primary care groups will begin to get them in the next, several weeks as the allocation gets higher and they're releasing more of those doses. But it's going to take a little bit. Do you want to go to the next slide? So another question I saw is that, the registration system is complex and it's difficult for volunteers and even for staff to figure out. The registration system is changing as it goes. It's learning where the problems are, where the glitches are, and what's difficult. But in the meantime, these are links to the clinician guide. It's a, how to get your clinic in there, how to use it, how to manage it, maybe have your volunteers walk through that. There's also a patient guide for how to register. Have your staff take a look at that as well so they can help any patients get through that. And then there's also a link to the patient portal. There's a clinician help desk, so you can call and ask questions about how to get to the next steps. And there's also a patient registration helpline that they can call. And the next one. So next steps for vaccine allocation for you all: continue to partner closely with your county health departments. check to make sure that you've finished that onboarding and training. You can still onboard through that system. If you haven't started yet, go ahead and start now. Even if you're not planning to give vaccine for the next few months, it's better to be prepared and ready to go. So start planning for your employee clinics as you begin to receive the vaccines. And it's your employees and any partners that you're working with on those pods. If some of the fire departments I know are going to be doing the municipalities, maybe the police departments. So start kind of planning through those. And then organizing the next tier of patients. So if you know you've got some high-risk patients, just start looking at those lists and figuring out who you want to prioritize first. And then if you're ready to bill or if you need any help, reach out to us and we're happy to jump in and try to guide you through those billing policies that come up as well.
All right. The billing is going to be really important. So remember, I know a lot of you have already been working with Jen, those of you who work in fire and EMS and are thinking about how to plan to bill in partnership with your county health department. Remember, this vaccine is covered by all insurance. And if someone's uninsured, they can also receive the vaccine. And we had a couple other just quick questions that I wanted to go before we jump into storage and handling. So those unable to leave their homes, I don't think that we're doing in-home vaccine yet, right, Macrina? I don't think any of the counties.
I don't think so. Here in Maricopa, we're investigating partners and vendors who may be able to do that. The most important part with those folks who are homebound is I'm sure they're receiving some sort of home health care. So make sure that those folks that go into the home to provide that care know that they're tier 1A and that they can get immunized as well.
Right. Jen or Macrina, has ACIP said anything about caregivers? So caregivers of parents with kids or that take care of someone with chronic medical conditions, which phase they're gonna be in?
I haven't heard that yet. Macrina, have you heard anything specific with that?
We have not heard anything specific of that, but we have talked about the fact that if you provide direct patient care, whether it's to a family member or whether it's to somebody who down the street pays you to come in to help, that may consider you as direct patient care. So, but that would be your call. There are so many gray areas here,
right,
that I think you really just need to take a look at it and
I think too, your best, look on your county health department's website. The counties are defining all of these groups. So for example, one of the groups in phase 1B is childcare workers. And in Maricopa County, where I live, they've defined that as anyone who cares for 5 or more children who don't live in their home. It's not necessarily someone who works in a licensed facility. So an unlicensed person or someone in your neighborhood who watches a lot of children, it does have access to that vaccine in Maricopa County. So if you're looking and wondering whether people who you care for fit into one of these groups, a good first stop is going to be from your county health department. Dig around on their website or email them to see if they fit into one of those groups. Another question around, are we scheduling clinics for second doses? The pods, you can schedule for your second doses now. And we do recognize that it looks like there's not open appointments in many of the pods. Remember, just keep refreshing those websites. And if you're working with people over the age of 75, there are partners who are able to help them on the phone to be able to try and book appointments. You can call your county for that information, and 211 as well. So, okay, so I know there's lots of other questions. I'm going to dig through. Oh, and there was a question about EUA. Yes, you give the EUA. It is 5 pages long, but you can email it ahead of time. And Tappy has created these postcards that have a QR code. If you would want to order those, we have them for them to order, right? We'll print them out for them and ship them to them, Jen?
Yeah, we're gonna do it as two options. One, you can download and print it on like the, the Avery postcard template or on cardstock, and then you can just cut them into fours. It'll be 4 per page. And then we'll have some to order. We're just getting these on our website right now, but the idea is you can give it to them. They land on a page on our website that has the EUAs on it. It has the what to expect after the shot, and some more information about reporting any adverse events, severes, that kind of information. So that's a landing page for that. The other thing we have here is the button up. We took the sticker, the CDC sticker, and put it on a button for healthcare providers for them to wear on their lanyard or, on their coat to remind patients that they did get their vaccine. That's the number one way that we can make patients feel comfortable about it, is that they've seen that you got the vaccine, you were comfortable with it, and you're standing in front of them healthy and well.
And Jen, are the uninsured folks billed through Optum like the COVID testing?
They are, yes, but you do have to collect some different information. You have to get a driver's license or a social security number. Since they don't have an insurance card, that becomes kind of their patient policy ID number. So be sure to get that information. You can bill it through Optum and be paid for the administration for the vaccine.
Okay. And then there's quite a few questions on when are PCPs going to get it, and we don't know the answer to that right now. We're right now, the system as a whole is looking at who can push out thousands of doses in a single day with, at a pod with 10 lanes and trying to prioritize those two. There's not a lot of product, but when we get it, we're trying really hard to get rid of it in those large pods. So hopefully that changes soon. We know, especially for those 75 and older patients who are going to struggle scheduling online, who may not drive anymore to be able to go to those. We know you are going to be a critical partner in that. And we hope we'll see when we have enough product to make sure PCPs get it as well. So, all right, we'll keep, and Jen, if you want to go to that chat, we would love your input to answer some of those questions as well. Keep chatting things in, and Macrina is going to talk about storage and handling. And
okay, so now that we've gone through the whole process of onboarding, you've allocated, you've got your system set up. So now I'm going to talk more about just the recipe, the nuts and bolts of the vaccine storage and handling and administration. So we're going to start with the Pfizer-Vaccine. I think that's the one that probably gives people the most consternation and fear, because we've never had anything before that's been stored at -80 to 60 degrees Celsius. So with Pfizer, it's a multi-dose vial containing 5 doses. There's 195 vials per tray, and they call it a pizza box. And it actually looks like when we first thought about it, we thought a pizza box, I was thinking like my Stress pizza box, which is, the extra large 5 cheese with extra pepperoni. But it's not. It's actually the size of an individual personal size pan pizza. So that's the size of the pizza box. It has 975 doses. It is shipped at -80 to -60 degrees Celsius. It's going to come to you in a thermal shipper, and you can store it a couple of ways. One is through the thermal shipper. One is an ultra cold freezer, which goes down to -80 or -60. You can refrigerate it at your regular 2 to 8, which is 36 to 46 degrees Celsius for up to 5 days. And at room temperature, no more than 2 hours. You will also receive an ancillary kit that will come with needles, syringes, a few masks, a few face shields, alcohol swabs, Band-Aids. The only thing that's not in the ancillary kit is actually a sharps container. Ancillary kit will show up routinely a day before the vaccine. So you not only do you get notification that it's coming through UPS or FedEx, whoever is delivering it, but you'll also get that ancillary kit, which means that vaccine is coming, and keep your eyes open. So with the Pfizer, when it comes to it's -60 to -80. So you have to thaw it. You have to really have a plan ahead. So you can remove a number of doses of vials that you need for that day from either the thermal shipping container or the ultra cold freezer unit. You do not need to have the ultra cold freezer unit. You can actually store the vaccine in the thermal shipper that is sent to you. You just need to, within 24 hours, replace the dry ice. You use pelleted dry ice, and then you need to replace it continually up to 10 days.
So how long does it take to thaw it out? How many days do you think they need to do that for?
Well, you
Or
can put it in the, right, so and you can put it in the refrigerator and it takes a couple of hours. You can put it in the freezer and it usually takes about 4 to 5 hours is what I've noticed. And then you can also put it at room temperature and it takes about 30 minutes.
Okay.
And with Pfizer, the smallest number of doses you can order is one pizza box, which is 975 doses. Okay.
So if you're planning, you know, when you're planning your events, you really need to think about that if you're going to get Pfizer.
You really do need to think about if you can actually, within 5 days after the vaccine arrives, if you can actually administer 975 doses, and this vaccine is easy enough to use. Before you dilute it, you do need to invert the vaccine gently 10 times. And when I mean invert it, you just sort of, I don't know if you can see my fingers, you kind of go like this, gently. The joke here at the county is that both of these vaccines are delicate flowers, and you do not shake them, you do not agitate them, you don't make them mad. You're going to dilute the vaccine with 1.8 mils of the sodium chloride, which actually comes in the ancillary kit as well. You're going to have a transfer syringe that's going to allow you to do that. As you put that 1.8 mils into the vial, you do feel a lot of pressure as you add the diluent. You need to ensure that the pressure is equalized by withdrawing some of that air. Again, do not shake. Most of us who've worked in immunizations know that it's okay just to shake that vaccine to mix it like we do our MMR and varicella. Remember, this is a delicate flower. It's like a gardenia. You just need to, again, do that 10 times. And then you really need to record the date and time of dilution because it's only good for 2 hours once you dilute it. Okay, next slide. Okay, Pfizer's schedule is 2 doses. It's separated by 21 days, 3 weeks, and it can be administered to 16 years of age and older. The screening questions, pretty simple. Do you have a severe allergic reaction to polyethylene glycol, which is part of the stabilizer in there? If the answer is yes, and it's an anaphylactic reaction, then that's a contraindication. Do you have a history of a severe allergic reaction to any other vaccine or injectable medication? If the answer is yes to that, that doesn't necessarily mean that it's a contraindication. It's a precaution, and we would observe that person for 30 minutes after immunization. If you have a severe allergic reaction to anything else, if you carry an EpiPen, if it's either food or bees or wasps, that's also someone else that you would have wait 30 minutes after injection.
Yeah, you know, I'm realizing listening to this is something that when we talked about workflows, we didn't really review because we kind of were had our minds about flu workflows. But in these private clinics for Pfizer, most of the pods are setting up 2 waiting areas. So the 15-minute one, which is much larger, and then the 30-minute one, which is smaller. So that's something you might need to change about your workflows for those of you planning to administer this vaccine. Just for folks who have severe allergies.
Right. And if you have an immunocompromising condition, it's a precaution. We still recommend you get immunized, but recognize that your vaccine may not build the full immune response that someone with a competent immune system would have. And if you are pregnant or breastfeeding, we say, please talk to your obstetrician or to your physician and ask them, because pregnant women have been hard hit during this pandemic. And so a lot of obstetricians are recommending immunization. Okay, with the Pfizer vaccine, it's IM and the deltoid. Again, something that's not real intuitive to us vaccine folks is you draw up 0.3 mils. So we are using a 1 mil syringe with a 22 to 25 gauge needle. And again, just be prepared to manage medical emergencies. You need to observe patients for 15 minutes. If they have a history of anaphylaxis, 30 minutes. And again, most of what we've seen so far in our large pods, 99.9% of them have been panic attacks. Having just did some immunization events myself, those of us who've administered vaccines a long time, we can tell if people are nervous. And so what I start to ask is, what are you nervous about? Are you nervous about the fact that every time you get a vaccine, you get nervous? Or are you nervous about this vaccine? Because you appear a little stressed. And then you just, you can have that conversation. If someone always is nervous and sweats whenever they get any vaccine, whether it's flu, tetanus, or COVID, then that's a different situation than someone who may actually have a little bit of panic regarding actually getting the COVID vaccine. And that's when I tell them, I got it, I did fine, I'd get it again, and here I am.
Macrina, we have a question in the chat. Can they, if a patient wants it in the thigh, can they get it? Can you administer in the thigh? If they're over, I assume this patient is over the age of 36 months.
Yeah, no, it's recommended in the deltoid. I don't know what the reasoning would be for putting it in the thigh.
Okay. All right. So, and then this is the Pfizer biotech website. They have tons of resources on here. They do lots of webinars and can answer all of those really specific questions about their product.
And the other good thing about this site is there's a lot of job action sheets. There's a lot of information sheets that we have printed up and we have actually laminated. And everything I went over is on there. It covers storage and handling. It covers preparation of vaccine administration. It will also supply you with little cards that you can attach to the vaccine that say, this is the time that it was drawn. This is the time that it was drawn or diluted. This is the time that it expires. So it has everything there for you. You don't need to recreate anything.
So we're thought it would be fun to find out which vaccine you all got. So we're going to launch this poll, and while we're doing that, we're also getting chats in here. How can I make sure I don't get Pfizer? So I think a lot of people, it is really different, and that is scary because it's new. It's different storage and handling. You don't get to dance around the office shaking it and things, but it's not that scary. Macrina said she was scared, and now she's like, okay, it's not that different. Here's the protocols. You just work on it. That said, chances are you will be getting Moderna, right?
In Maricopa County, if you do not have an ultra cold freezer that has been verified through ADHS and on the allocation sheet, you will not be getting Pfizer.
Right.
Those who do have that equipment will be getting Pfizer. You all need to remember that Pfizer is going to continue to come. It's going to be part of the vaccine rollout. It's going to be one of the multiple vaccines out there. And for us to have the ability to immunize everybody, we're going to have to continue to use Pfizer. It's not as scary as it sounds.
Right. And then we also had gotten this question, do I need a separate refrigerator? No, don't buy a fridge.
No.
Don't buy a fridge yet. There's plenty of products that you're going to be getting.
Right.
Now let's talk about Moderna.
Okay, so now I'm going to talk about Moderna.
And this is the one most of our people have gotten on the line today.
I know, and I see some extra folks talking about Moderna. Yes, Moderna is 0.5. So Moderna vaccine, it's a multi-dose vial, contains 10 doses. You get 100 doses in a box, 10 vials per box. The minimum order is 100. Now this vaccine does come frozen, but it comes frozen -25 to 15 degrees Celsius, which is pretty much how you store other frozen vaccines. So whatever units you currently use, this is perfectly fine. It can be stored at refrigerator temperatures for up to 30 days, which is nice and gives you a little bit more flexibility. With this vaccine, you also receive an ancillary kit, and you'll receive one ancillary kit for each 100 doses. Comes with the exact same stuff, syringes, gloves, face shields, alcohol swabs.
No biohazard.
No bio,
Sharps.
no sharps container. The vaccine, again, must be thawed in the refrigerator or at room temperature. It takes 2 hours to about 30 minutes if you do it in the refrigerator. At room temperature, about an hour. Vials that have been punctured may be kept at room temperature for up to, I believe that's 2 hours, not 12 hours.
Oh, okay. We'll make a note to fix that before we send out the slides.
Yeah. And again, once the vial has been punctured with this vaccine, I think it's on the next slide. Once the vial has been punctured, it is only good for 6 hours, just like the Pfizer. Neither one of these vaccines have any preservatives, and so that is the reason why once you puncture the vial or once you reconstitute and puncture the vial, you have to use it within a certain amount of time. Again, this is a very delicate flower vaccine. You gently swirl, do not.
What does a gentle swirl look like?
Well, for this vaccine, they recommend that you put it between your hands. Can everyone see? And you kind of roll it like this.
Gently.
Pfizer recommends you do this. Moderna, you do this. You withdraw half a cc, half a ml, which is more intuitive to us vaccine folks. It should not be cold to touch when you administer it. And again, you've got to note the date and time after you puncture the vial. It's goes in the deltoid IM. You can use a 1 ml or a 3 ml syringe. And again, same size needle, 22 to 25 gauge. This vaccine is 2 doses separated by 28 days. And 18 years of age and older is what they are under their emergency use authorization. The good news, the one consistency here with both of them is that they have the same vaccine screening questions and the same process, same procedure. You're going to observe that anybody with any sort of anaphylactic reaction for 30 minutes. And you are going to be able to immunize both pregnant, breastfeeding, and immunocompromising conditions. Or both, you're able to vaccinate. Just keep in mind that immunocompromised folks may not get as robust immune response, and that pregnant and breastfeeding women should check with their provider.
And there's tons of things about, we have gotten lots of questions from pregnant moms. So make sure they check with their provider. And I think that ACOG, the American College of Obstetricians and Gynecologists, has recently put out some resources, and the Academy of Pediatrics has some things too that they've put on their Healthy Children website. So
right, with both these vaccines, the minimum spacing is 21 and 28 days, but there is no, if you don't, you never restart. So if you don't get the vaccine within 21 or 28 days, you're not going to restart. You're just going to catch them when you can and give them the second dose. Both of these vaccines have shown that about 2 weeks out after the first dose, you're going to get around 50% immune response protection. And then after that second dose, again, it takes about another 2 weeks to get the full protection that you're going to receive from the vaccine. So we tell most folks that with Moderna, it's going to be about 6 weeks. And with Pfizer, it's going to be about 5.
okay.
Then again, please go to this website. We have used it with Moderna. We've taken both their sheets that cover vaccine preparation, administration, and screening, laminated them. They will also give you, you can make stickers to put on your box. Once you defrost it, it'll tell you date defrosted in the refrigerator, date it expires. So there's all sorts of great tools here that will help you. I know that in Maricopa County, we're trying to send, if you get Pfizer, you'll continue to get Pfizer. If you get Moderna, you'll continue to get Moderna. I think it's really easy for clients and patients to remember where they got the first vaccine, easier than having to shop around trying to find the right vaccine for that second dose.
So we have a couple questions coming in from on the chat. Quite a few people have said that when they're getting their Moderna, they're getting extra doses in the boxes. Should they use those extra doses, or what do they do with it?
Yes, with both Moderna and Pfizer, we are finding that with Pfizer, we're getting 6 doses out of several vials, and with Moderna, we're actually getting 11 doses out of several vials. It is perfectly okay to use that additional vial, that additional dose in each vial. CDC has approved it, ADHS has approved it. So if you get extra doses, you can pull them up, please, and administer them. You cannot pull part of a dose from one vial and part of a dose from another vial to get a complete vial. I hope, did that make sense? If you can get a full dose, you get a full dose. If not, there's no marrying vials for a dose. Thank you. That's a good way to put it. Thank you, Liberty.
Can we pre-fill 10 doses of our Moderna ahead of time?
Yes. If you're doing mass immunizations, and that's how most of the pods are doing it. That's how I did it yesterday at a pod, was I drew all 10 doses because I knew I had 26 people coming. So we would draw 10. That's perfectly okay. Remember, once it's drawn, it's only good for 6 hours.
Is it better to keep the vaccine in the fridge or freezer? And I don't know if this question from Maria is about Pfizer or Moderna, so maybe answer it for both.
Okay, so for Pfizer, so for Pfizer, it needs to be kept in the freezer. Once you put it in the refrigerator, it's only good for 5 days. It shortens that expiration date to 5 days. So if you know that if you pull out 10 doses, pull out 50 doses, put in your refrigerator, if you know that you're going to see 50 patients within that 5-day time frame, then you can keep it in the refrigerator. If you not going to see 50 clients within that 5-day time frame, I would not keep it in the refrigerator. With Moderna, once you put Moderna in the refrigerator, you have 30 days to use it. So part of that is why most places are not allowing walk-ins, and why a lot of them are doing appointment only, is because of the intricacies of the vaccine's expiration date becoming much shorter when you store it in refrigerator for either one.
Okay, and then is it 2 hours not punctured and 6 hours punctured? How long can they keep? Let me find that slide.
Just find that slide. No.
Vials that have not
punctured. Yeah, can be kept at room temperature for up to 2 hours.
2 hours. Yeah, that's the typo slide.
Yeah.
Pfizer, can we order Pfizer for 16?
Well, maybe it is 12 hours. I could be wrong.
Jen, can you look that up while we get to
I'm going to look it up right now.
Okay, Macrina will look it up right
Yeah.
now. I'll answer the next question. How about that?
Oh, perfect.
So can we get Pfizer for 16 and 17-year-old patients who have special healthcare needs? No, they are not included in these phase 1A and phase 1B groups. As we are still in this shortage, we really need to try and stick to the people who are eligible, since that's what ACIP is saying is going to get the most protection and save the most lives. So not right now. Those patients do not qualify. There's a couple questions in here around onboarding. Jennifer, if you can try and get to those, but remember the onboarding process of who gets vaccine and who gets approved is managed by ADHS. So we will try to answer what questions we can, but be sure to look at that onboarding link. Reconstituted vaccine held longer. Can we hold reconstituted vaccine longer than 2 hours in syringes? We're keeping
Okay.
coolers.
So once it's So once it's at room temperature, it's good for up to 2 hours if it has not been punctured. So there's a difference between punctured and room temperature. If it's punctured at room temperature, it's 2 hours. If it's not punctured at room temperature, it's 2 hours. Once it's punctured, if it's kept at the refrigerator temperature, it's 6 hours. Does that make sense?
So if you're putting it in a cooler or anything like that, make sure that you most definitely have a data logger in there too.
Right, right. So that's where it can get a little confusing. Room temperature is 2 hours, up to 2 hours. Punctured, as long as it's refrigerated, is 6 hours.
Right. So these are a couple questions that I've also seen in the chat, but were emailed to us ahead of time. So how long do you have to restart if someone doesn't come within the 21 to 28 days?
No, not that we've gotten no direction on that yet.
Right. So, and typically with any vaccine series, we never restart a series. Just know that when the trials happen, they're studied at 21 to 28 days. That's how they're studied. So
Right.
that's where that recommendation comes from. Is there a grace period for the second dose? What if they give it early?
Yes, we have heard that there is that 4-day grace period is acceptable. Not optimal, but acceptable.
Okay. And then we also I got my first dose. Then I tested positive for COVID. We're sorry that you got sick. A couple days later, when do I get my second dose?
Okay, so there's 2 schools of thought. One is that once you are no longer quarantined and once you are symptom free, you can get the second dose at 21 or 28 days later. You can also, there is some recommendation that you can wait up to 90 days. Wait 90 days till after your test before you get vaccinated. I know that's not a really clear answer, but what we're doing in long-term care facilities is that once they're out of quarantine and they're symptom-free, we're going ahead and immunizing them and not waiting that 90 days. There is some discussion that your immune response, that your body responding to that immune response may be a little bit more robust, and so you may have a little bit more significant normal side effects. But it's anywhere from 90 days to once you're symptom-free and out of quarantine.
And if a patient is asymptomatic, but they're waiting for COVID test results, can they get the vaccine? And I mean, if
you're asymptomatic and for some reason you decided to go and get tested, I would wait for those test results because you went to get tested for a reason.
Right.
You were exposed to have close exposure to someone who is positive. If you have not tested, there's no reason to test, so go get the vaccine.
Yeah.
Right.
I mean, guys, we know that the spread, it's still there. We are not going to reach herd immunity anytime soon. So we cannot let up on our messaging to people about stopping the spread, to stay masked if you have to be around your people who don't live in your household, to wash your hands. And if you have gotten a test, you need to quarantine until you get the results of that test. I mean, all of those recommendations that we've been doing in our pre-vaccine world, we all still need to do our best to make sure that we continue those messages so that our case rates go down and so that communities can recover, because they're being devastated, many of our communities. So if someone is asymptomatic and getting a test result, doesn't matter if you have symptoms or not. If you got tested, we are asking you to stay home till you get those results.
Because you're testing for a reason.
Right.
Either you're testing because you're a household contact, you've been exposed to somebody, there's a reason. So if you're asymptomatic and you're getting tested, you still need to quarantine. And then once you get the results, if you're in one of the priorities, go out and get your vaccine.
Another kind of workflow question, can one person draw up the dose and another administer?
Yes, that is currently what's happening at all of our pod sites.
Okay.
We have nurses and pharmacy techs doing the preparation, and then nurses and medics and MAs administering.
Okay. All right, and so there's other questions kind of specific about your pod and things, so we are going to try to stay on top of that. I know we try to just get your question. We know we have you for the next few minutes, so try to get your questions answered. And I know sometimes it looks a little disorganized, but hopefully we're getting things answered. Anything we don't get to in that chat box, we will do our best to find those answers and then include that in a handout when we send out the link to the slides and the recording. So,
and again, I cannot, as you can tell, it can get confusing. So I cannot tell you enough to go to those 2 sites for each specific vaccine and pull up those sheets, laminate them, have all your sites, because they will answer all of your questions. That's how I just answered your questions and clarified what I said, was you got to have this information available.
right. And it's all new for all of us. So
Yeah.
it's, it's not second, not that everything in vaccines is always changing anyway, all the time. So, recommendations and things like that. So, but we do want to make sure that we share with you some of the really common mistakes that we've seen, because we know, especially our fire and EMS people love talking about failures, and we love hearing about them. So the number one thing that we have seen that is not happening the way it needs to is the immunization record. The little cards that you get don't include all of the information, especially about the lot number and things. So what needs to go on this card? And this is Macrina.
The record books will come in the ancillary kits. You can use either labels or you can hand write them. And with each ancillary kit, you will get 100 record books. So even if you are getting additional doses out of the vaccine and going through record books faster, you will continue to get more record books. So you should be okay, because hopefully dose 2 people will bring their record.
And do those ancillary kits have those cards in them?
Yes, they come with the cards.
All right. Another thing that we're seeing is wait time. So Macrina, tell us what happened to you when you got your dose at the fairgrounds.
Oh, so I got my dose at the fairgrounds, the first one, and I was like one of the last people in line. And so they changed the process up a bit, since there were only about 10 cars. They had me wait in the bay. They didn't take me to there was an identified area earlier in the day where cars waited. So I sat there and waited my 15 minutes. And then when I left the bay, I took off. Well, lo and behold, all of a sudden 3 people are running at me and 2 golf carts are coming at me. So I have to give kudos to Banner. And after a very long 12-hour day of immunizing folks in a pod, 3 people had enough energy to run through the parking lot at the fairgrounds to stop me.
Yeah.
And I'm like, no, I waited. So they take it very, very seriously. So it really is important to have a system in place, have people monitoring the parking lot. Again, 99.9% of the folks aren't having severe allergic reactions. A lot of it is kind of fear and panic, but put them in a system so that you can at best make sure they wait 15 minutes. When I went to get my second vaccine, what they did was they lined us up. So once you get in that line, you can't get out, because I had cars on either side of me. So do all the best you can to make sure people wait the 15 minutes.
And we know we've talked at length on previous webinars about, how do you really get them to do this? But for this vaccine, because anxieties are high of the patients who are coming, because everybody is very anxious right now with the whole pandemic and everything related to COVID, really try your best. And the other thing that we've heard is some people don't think that they were told to wait. So make sure that you are, that it's in your workflow and in your process, and that you're checking to make sure that you're telling the patients, but try to make sure that they heard you. that you're asking them to wait so that they don't go to their car if it's a walk-up clinic or go home and have something happen?
So what we do is, I've done both drive-through and walk-up. So with drive-through, you just put the time that the vaccine was administered on a sticky note, not high tech. You put it on a sticky note. If it's drive-through, you put the sticky note on the windshield, and you let them know that this is their time. I did a walk-up, and the last 2 days, and what I did was I give them a sticky note. I yellow with red marker, and we have an observation area, and we just have people walking through the observation area, just chit-chatting. So just give them kind of something to do afterwards.
Yeah, and Liberty's saying they use chalk markers and write it on the windshield, which is also good. But try your best to get them to wait and make sure that they heard you say that they need to wait.
Yeah.
Oh, Macrina, the demand.
Oh, this is really, really difficult because we don't want to waste a single dose, right? I mean, we have people who are chomping at the bit, who want to get this vaccine. So we do not want to waste a single dose. So the whole idea is trying to figure out, and that's why we're doing a lot of this by appointment, is how many appointments do you have? How many people do you have coming? And kind of plan for that. Always have a backup plan if you have leftover doses. So we did an event, Moderna, and we had 3 doses left over on day 1. So we had 6 hours to use them. Vial was punctured, it was in the refrigerator, we had 6 hours. So we just had folks on call. We had 5 folks on call to say, okay, now be prepared. Our clinic is going to be over at 1 o'clock, and we're going to drive by and immunize you. And that's what we did. So kind of have backup plan. We don't really want to waste any doses. The other plan is if at the end of the day, your clinic is done and you're sitting there with unused doses, don't worry whose arm it goes into. If I know we're in 1A, 1B, 65 plus, but if all you have at the end of the day is somebody who wants to take the vaccine and you have doses left over, then give it.
Not throughout the day, but just make sure that it doesn't get wasted. Because remember, it's not that the vaccine is not approved for other populations. It's that there's not enough for all of us yet. So
correct, there's not enough.
Rather than wasting, yeah.
Correct. We don't, I don't recommend going down to the local Circle K or anything, but I do recommend that just having some people, on standby who you can give that vaccine to. So we don't.
Are you in your pods, and anyone else who's had experience running, because we know about a third of you are doing pods as well, either alone or with the county. Are you getting no-shows? What's your no-show rate?
Oh, very rare. This is also a good time to immunize volunteers. So if you have volunteers who are helping you with your pods that may not fall into that age group, what we've been saying to our volunteers is that at the end of the day, we will most likely be able to immunize you. And that's how we've been using a lot of our leftover doses.
Yeah. And people are in the chat are saying very rarely are they getting no-shows, but you know what people do get? They get walk-ins who think they have an appointment and come with a handout, with a printout, but they didn't book that appointment. So when you're doing your workflows, have a protocol for what to do with walk-ins, because they're happening. And that leads right into our scheduling common mistakes. So clearly instruct patients to book their appointment, especially as we are starting to partner more with organizations that work with those 75 and older. For a lot of you primary care offices, we know that you were just getting flooded with calls from patients, and we are so appreciative that so many of you are helping them do appointments on the phone, because we know that you are so busy to be walking them through those scheduling systems for those other pods, but make sure that you give these really clear instructions. Anything else on the scheduling thing? Because this has been a big.
Yeah, I think the scheduling, and I think the thing that we need to keep in mind is that the more the vaccine becomes available, so the more we get it out to pharmacy partners who are going to do our 75, 65 plus, the more we're getting it out there, the more likely we are to see some cancellations at some of the larger pods. So just keep in mind that as vaccine gets more distributed and people can go to places they're more familiar with, they may cancel an appointment that they're to at a location they're less familiar with.
Yeah.
So I think we'll see more cancellations as we go on.
Right. Okay, so how do you tell people what to expect?
You know what? I just be incredibly honest with folks. I tell people my experience. I had my first dose. My arm was sore. I felt a little punk, which was a term my grandma used to use, which meant that I definitely felt like I was coming down with something, you know, kind of body aches, not feeling 100%, little foggy brain. 24 hours, it went away. I just received my second dose. This last Monday, as my record card showed. And honestly, my arm was really sore. I mean, it hurt. And I had trouble sleeping and I couldn't get comfortable. And the next day my head was foggy and I felt a little nauseous. I mean, I really did not, I felt like only 40% that day. I still went to work. I didn't have any problems. I didn't have any fever. But I'm just really honest to expect those kind of normal immune response reactions. But I told a lot of people, I said, you know what, at least I think I got documentation that the vaccine took good, as my grandma would say, you know, so it actually didn't bother me. I said, you know what, it just showed that I was building an incredible immune response. And I got documentation because I had a crappy day on Tuesday. And just be honest.
Yeah, and one of the things that CDC is, you know, language is really important, right? Words really matter. And rather than saying reactions, we're trying to change the how we talk about that and saying responses, because it is your typical immune response is to feel a little punk, and to you know, have a sore arm and things, but some people are reporting that this is worse than when they had their shingles shot. You know,
Yes, it was worse than my shingles shot.
Okay.
And I whined about that.
She did whine about that, but she did get to drink wine and have pizza the day after. So she was happy that she felt well enough to go with friends after her shingles shot.
Yeah, so I just think be honest with folks. It's just your body building its immune response and responding to the vaccine. It's actually a good thing. It's not a bad thing. But on the other hand, if people don't have side effects, doesn't mean anything. It just means that maybe their body's responding differently.
Right. And we're so appreciative that of all the excitement for this vaccine, and that all of you are so eager to administer it. And it is exciting. But when a patient asks you, you know, could I get sick from this? You know, will I feel sick tomorrow? Please be honest with them, and trust that your patients will make the right choice. They're just asking a question. It doesn't mean that they're anti-vaccine or anything like that. Just give them the right information. It's going to do two things. It's going to help them feel more confident in their decision and make them realize that they're making that with all of the information. And your front desk is going to be very happy because they're not going to call in 6 hours saying, my arm's really pretty sore. I don't think that this is normal. So just be honest with them. And CDC has this great handout on what to expect after getting a COVID-19 vaccine. TAPI is continuing to create resources as people request them or need them. If you are working on things, just let us know. We'd love to help you with those. Another thing around billing, Jen, I know that you're busy on the chat, but can you talk about what those big mistakes are for billing quickly?
Yeah, right now we're finding that some of the mistakes around billing are not collecting the right information. there have been some policy changes with that. So Medicare Advantage plans, which some of you may be familiar billing, you typically get the Advantage plan policy card when you get the card, but you don't bill the Advantage plan for this vaccine administration. You bill Medicare directly, so you need the Medicare number or the Social Security number of the patient and not the Advantage plan number. I know that was one of the things that tripped up some. Again, for the uninsured, we talked about a little bit earlier, you have to get the driver's license number or Social Security number. If you have patients that don't have either one, you have to attest to the fact that you asked for it. If they didn't provide it, then you can still submit the claim to Optum, and they'll give you a patient ID number with that. That'll be a little bit different. But just, gather the private insurance information. You all know with billing, sometimes it gets behind. Every time there's a change to a vaccine, whether we get a new Prevnar vaccine, it takes a while for the health systems to get them loaded. They are loading all of that information. If you get denied claims first, resubmit those, continue to do that. It could just be one of the plans are not up to date yet.
How do they attest, Jen? Do they do that on the Optum? Is there a box for that, or?
When you sign up and when you submit a claim, you are attesting to the fact that you have asked for it. So I tried to get them to answer this directly. What do we have to do? And they just said, if you've submitted a claim, you guarantee that you attested to it. I said, okay, yeah, but what does that mean? What do we have to ask for? Do we have to wrestle them down, track them down? And they just kept saying, if you've submitted a claim, you have to attest to it, which kind of means there's really no way you can prove or show what you did, but on good faith, try to get as much information as you can.
Okay, thanks. Okay, so I'm gonna look for on the chat. We have just a little bit of time left to get through some of these other questions. So again, as we do these Q&As, it kind of looks a little unorganized and we just ask things from left field to Macrina and then she just rapid fire answers them. So in no particular order, should someone that had a significant post-shot symptom, so response, expect a significant response on their second shot?
Yes. I'm going to say that what I've heard most people say anecdotally from folks is that the second response was more significant than the first response.
And that's also the data from the trials too, that people had more significant responses after the second dose. So yes, but you know what? Please,
it's worth it.
Yeah, it's worth it.
My coworker who went with me on the 11th to get the second dose, hers was much less than mine.
Oh, good.
Yeah, so I'm not really sure.
Okay, so if you're immunizing people in cars, then you need a place reserved for the post-vaccination in parking lot. Yes, you do. And if you need workflows for that, they are on our website and we'll send some kind of map looking things, and we'll make sure to send you that. And if Chief McCluskey can figure out how to do that in that little firehouse in Heber, then I think that you can figure it out too. So it does take some creative managing of where you place cones, but we can all do it. Are people able to pre-medicate, take Tylenol or Motrin before they get a vaccine?
We haven't seen anything about that. We know that with your routine vaccines that were, your Tdaps and all of that, we tell you not to pre-medicate because it could diminish the immune response. We haven't seen anything like that for either of the COVID vaccines, but my recommendation is always to hold off taking anything until you know you need something.
Okay.
So definitely post if they're having discomfort and they want to take something else. I wouldn't recommend pre-dosing with any Tylenol or Motrin. Is Access providing rides for their patients to the pods? Do we know that? That I don't know. I do know that some of the pods have come up with Uber and cab administration spots so that folks don't have to take all the time. They can kind of expedite if they're in cabs or Ubers.
And dial a ride too, but is Access providing transportation, Jen?
Yeah, that came up yesterday, and I think they said that they were getting some information up on their FAQs under the Access page, and to contact the insurance companies, the Access plans, to see, you know, what their plan was for that. But I believe that they're putting that in process. Let me get the FAQ page for Access, and I'll get that posted.
Thank you. Yeah, and thanks for asking that question. Can we give COVID with other vaccines?
Right now, no.
Okay.
We're asking people, have you been immunized within the last 2 weeks?
And if they have had an immunization in the last 2 weeks, are you making them wait?
It's not we're asking them to wait. If it inadvertently happens, like I immunized somebody yesterday who had about 5 days ago, you don't have to repeat the vaccine.
Okay. And how long after you get your COVID shot do you wait to get your shingles?
We would recommend 2 to 4 weeks.
Okay. All right. We have these new tools as well that we will put on make sure are on our website if they're not already on there. An updated consent form, some information about the vaccine, and then a new pre-vaccine checklist for COVID vaccine. So we'll make sure that these get on that website, and we will send out that link with all of our checklists for drive-through clinics and things like that. If you have new resources, or you have your own checklists or volunteer training packet for who's going to volunteer at your registration desk, anything that you will allow us to put on our website and share to your colleagues who are doing these things is going to be invaluable. We have gotten so much feedback from that webpage, and the things they love most are when we send them Pima County's, your protocols that you'd already written out, or share pictures of those clinics up in Heber. So anything you can give us, we really hope that you will send it to us so that we can post it up there. And we have been doing these webinars, and we're wondering if I'm going to launch 2 polls kind of quickly here. We were doing these for every 3 weeks. We're wondering if we need more. And if you are answering yes, you still need more webinars, please chat in what topics, use that chat box to say which topics you think that you really need them for. We are doing another one that's directed to physicians. And when is that one scheduled again, Jen? The 28th?
I believe so. And I think I have it right here.
Great.
There it is. It's in the chat. 28th, 6 p.m.
The 28th. So tell your docs, your nurse practitioners, your PAs, your providers about that webinar. We're really trying to create a space for those healthcare leaders as well to hear from each other about how they're talking. So we're getting kind of like a maybe on whether or not that we would need another webinar. Which kind of makes sense to us because we feel like there's lots of different webinar options now. But if you do, so we'd like this poll to be answered by our medics and our EMS folks and our fire departments only. Do you need things specific for you still, or are you good with kind of just signing on to the things that are for the broader healthcare audience? All right, and I will keep that open for just a little bit longer. So just so we make sure that we get that information. We can't thank you enough. We have all, Macrina, Jen, and I, and the whole team at Tappy, vaccines are our thing. This is our time to shine. This is what makes us so excited and gets us out of bed every day. And we have been so inspired watching you get your vaccines. It literally brings tears to our eyes every time we see a post of a firefighter on Facebook, or a nurse or another healthcare provider. So we really can't thank you enough for what you're doing out there. We are trying to do our part by giving you best practices and to really help you connect with one another and ask questions. This has been a little bit of a rapid fire training, just kind of reading off questions and having Macrina answer them. But I think it's because everyone's really eager for those answers. We are available for you really kind of 24/7. Call us, text us, email us. As soon as we get your messages, we will try to respond. And we really see our role to partner with you and give you whatever information that you need as our time allows. So hang in there. We know it's still really rough, and are thinking of all those communities who are really still being impacted. As excited as we are about this vaccine, there are a lot of people really struggling and who are really experiencing a lot of devastation. And that's who we're doing all of this for, to prevent it in the future. So thank you for signing on, and we will see you next time. Bye, everybody.
Bye. Thank you.
Bye. Thanks.
Bye.